So, first thing we should talk about is what is a health equity zone. We have 10 in Rhode Island, and the North Providence School Department is one of the 10, HESs. Health equity zone, a zone is a geographic area. So, for example, North Providence School Department works with Maryville and Birchwood schools and surrounding neighborhoods to create initiatives and programs based on a needs assessment, which was done in year 1. So this is a 3 to 4 year grant cycle, and in year 1, North Providence reached out to, the school department reached out to residents and asked them what they really needed in their community. So this is totally about community engagement, about residents buying into it, and if they have a stake in it, they're more likely to become more engaged in the community.
The North Providence Health Equity Zone is really dedicated to building and sustaining a community where every person has the opportunity to attain their full health potential. We are really seeking to cultivate and develop this idea of a multidisciplinary partnership within our community and even surrounding areas so that we can kind of foster innovative solutions to achieving health equity, basically including everybody. And we're also trying to cultivate this concept of volunteerism. So everyone's coming to the table, everybody's working. It's everybody's job and responsibility to try to help bring health equity to North Providence.
The number one issue on the needs assessment was the lack of a community center for kids to do something after school that weren't sports oriented. So that's why we developed this. So we're going to have enrichment programs here. And we're hoping to also have a diabetes prevention program for the parents so they have a place to go as well. And also all our HES activities will be located here. My name's Liz Vachon, and I am a social worker for the North Providence School Department and also a Health Equity Zone Director for the North Providence community. Originally, when I started being a therapist in the school with the kids, I was seeing probably about 5 children a day, where I was really able to focus on those particular kids and families. But the climate has changed dramatically in the community, so I went from 5 kids a day to about 35 kids a day. And I felt even though I was able to help the kids individually, I wasn't able to take a more holistic approach. I wasn't able to work with the families. I wasn't able to provide resources in the community. And I felt that HES director enabled me to be able to do that. So that's why I agreed to take the position. I really can see the benefit now, because last year was mostly doing the research and surveying people, but now we're actually implementing everything. The youth center we're really excited about. So I think as the year progresses, the residents are really going to start seeing the benefits of the program.
My name is Nikki Bond. I am a Master's of Social Work candidate at the Rhode Island College. And this year I have the privilege of being a macro social work intern with the North Providence Health Equity Zone. The great thing about this is that I am also a North Providence resident, and I'm a North Providence parent who has 5 kids who have been in the school system at some point, who have been part of the community. And I'm really excited to continue as an intern for the North Providence Health Equity Zone. So in the beginning, as a community, not everyone knew what it meant to strive to have good health. I think we thought, well, the doctors take care of that. When they tell us we're healthy or we take our vitamins, then we must be healthy. And I don't think we understood what it meant to achieve health equity either. What I've seen happen is the community really come together and take ownership of health equity in North Providence and validate the concerns of the residents and the parents and the students that good health isn't just a good physical. It's how do I feel mentally today? How is my mental health? We've learned that we can see changes in people's healthy food choices. Now that we have the Rhody Food on the Move, it's a food truck essentially. It's a farmer's market on wheels. Come directly to the school, because one of the problems that we've learned is some parents don't have transportation to get to the farmer's market, so we wanted to bring it to them. And that's been a really great event to watch, and people can buy fresh fruits and vegetables. They can use their SNAP benefits. In fact, if they do at this particular food truck, they get 100% back. So if they spend $10, they get $10 to spend on fresh fruit and vegetables. So I've just really seen, I think the biggest change is not just depending on the doctor's office. Viewing the whole community, whether it's the school department, the police officers, the firemen, all the municipalities, small businesses like the Hopscotch Room, come together and say, we want to all work together to be able to help the community be more healthy. It's not just one person's job, it's everybody's job.
So when we speak about community engagement, we speak about all through the life stages, all different ages, speaking about elementary school kids and middle school kids and seniors and parents and many people from different life stages, which is in a totally engaging environment to be involved in. One of the best things I think in the youth center is that you're asking youth what they're looking for. Rather than to just throw programs out there, you are actually engaging them in the process, which is seen on the whiteboard, which is, it's up to you. What activities would you like to see after school? So I think it's not only have you created this beautiful environment and safe environment for kids to be involved in and to participate in activities, it's a beautiful setting, but you're also engaging them in the process of discovering through them what they're looking for.
What would be the #1 goal for all the HESs, do you think, to achieve?
Well, it's basically at the simplistic definition level, it's really about making health equity possible for everyone, giving everyone equal opportunities to live healthy, happy lives. It's the social determinants of health, where the people around you, your physical environment is safe and healthy, that you are offering opportunities for young and old to come together and to just live healthy, happy lives.
I just wanted to introduce Melinda Smith, who is the superintendent of schools in North Providence, and Bruce Butler, who is the principal at Maryville, running all the programs at Maryville School. And I know I've said this before, but without Melinda, this wouldn't have happened.
So the grant proposal came in my inbox, and I had been looking for, as you well know, Liz, to bring community organizations into the district to help us with some of our health issues, including mental health issues that we see are on the rise with our middle school population. I think some of the challenges have been that we are an educational institution, and we're working with the Department of Health, and there are 2 different agencies, so certainly working together has not gone without challenges, as you well know. But through it all, the benefits have outweighed any of the bumps that we've hit.
And Bruce, it's so nice to highlight Maryville, because I know Maryville has been so much a part of you for many years and how you engage with the community. So I just wanted to ask what your experiences have been.
Well, I've been at Maryville for 12 years, so over the past 12 years, like Melinda has said, I mean, we've seen a great need for supplemental services. We've done as much as we could possibly do with the school personnel and a lot of volunteers that we have available to us. But since we've had this opportunity to be part of the HES, we've been able to expand a lot of the programs, like Melinda had just touched base on a couple of them. And we have Food on the Move coming, so we've had them at the school once, and they were excited about the participation and the turnout with the families and the faculty and staff. And so we have another Food on the Move coming, and they're really going to try to cater to what the needs of the community they're asking, what kinds of fruits and vegetables they're looking for.
This is a fantastic mural. My question to you, sir, is what does it mean to you as the principal?
Well, on a professional level, it's actually building community. So it's a family engagement activity. So we have everybody that's in the family participating. So we have a flower down here. There are brothers and sisters. And one of the siblings is not even in the school, it's a younger brother. So those students, it's showing their family relationships, obviously in the school. So we're doing just fall colors because of the time of the year. The kids really love it. They've been really excited about this because we had this mural painted over the summer. So when they came back into school, they saw it. We told them that we were going to be doing some activities throughout the course of the year where your families can come in, everybody can participate and be part of the school community. On a personal level, I think it's great because I have built relationships with these families over the 12 years that I have been here. So I know these people, I know everybody's names, all the family members, I know a lot about them. So it means a lot to me that we're here doing this together because someday we may be moving out of this school. And so we'll have something that we can leave together. To say that this was our home and this is how we're going to remember our community that we were together here.
It begins by joining together, believing in the potency of inclusion, and building from a common bond. It embraces complexity as a cause for collaboration, accepting that our fates are inextricable. It recognizes local leaders as national leaders, nurturing the wisdom and creativity within every community as essential to solving the nation's problems. It demands honesty and forthrightness, calling out racism and oppression, both overt and systemic. It strives for the power to realize our goals while summoning the grace to sustain them. It requires that we understand the past without being trapped in it, embrace the present without being constrained by it, and look to the future, guided by the hopes and courage of those who have fought before or beside us. This is equity, just and fair inclusion into a society in which all can participate, prosper, and reach their full potential, unlocking the promise of the nation by unleashing the promise in us all.
So we have our charge set before us. And what better way to take the first step in addressing our equity manifesto than to be able to have the distinct honor of introducing Dr. David Williams, who is our keynote speaker. And without further ado, please give a warm welcome to Dr. David Williams.
And good morning. So I want to talk about what we can do to improve health that Rhode Island faces and the rest of the United States faces. And I want to begin by talking about what the problems, and then we want to talk about what some of the solutions might be, given an emphasis to starting early in life. What are the problems? I think the first problem was highlighted already, and that is, in spite of the fact that we spend more money on medical care, absolutely more money on medical care per person than any other country in the world, we rank near the bottom of the industrialized world on health, and we're losing ground over time. According to the World Bank, half of the money spent on medical care annually is spent in the United States. We are less than 5% of the world's population, consume 1/2 of its medical resources, but rank near the bottom of the industrialized world on health. Not only that, there are large inequalities in health by race and socioeconomic status, and I'll talk about that. But it's not that just the minorities are doing badly. If white America were a country, in 2014 it would rank 34th in the world on life expectancy. If black America were a country, it would rank 96th in the world on life expectancy. These are the actual rankings of how poorly we are doing on health. So I'm going to talk about inequalities, but as we think of improving health of all and addressing inequities in Rhode Island, remember the first big inequity is that all of us are far less healthy than we could or should be.
As a whole, we are greater than the sum of our parts. And the reason for that is the vision that's set by Secretary Roberts as well as by our governor for how government can and should work to make people's lives better is critical. And to be a part of that is what motivates me to keep going every day. your voice is important. And we want to make sure that there's a continual platform so that all voices are heard.
Nobody could possibly do this alone.
Well, it takes a team. It takes a team of people, and it takes a team at all different levels to become engaged and participating and contributing their time. But it's such a worthwhile, rewarding process.
I conclude with the words of Robert Kennedy. He said, each time a man or woman, I would add, stands up for an ideal, or acts to improve the lot of others, or strikes out against injustice, he sends forth a tiny ripple of hope. And those ripples can build a current which can sweep down the mightiest walls of oppression and resistance. We have walls of oppression and resistance. We have been told that there are more walls that will be built. But together, each of us can be a ripple of hope and can make a difference to improve health for every child and every adult in our community. Thank you very much.